In this week's episode of Mommy Talks, we are joined by Dr. Felix Oindi, a gynaecologist obstetrician at the Aga Khan University Hospital, to discuss all about postpartum depression, what it is, how it manifests, how it can be managed, and so much more. Stay with us. I'm Catherine Karong'o. Let's start with the definition of the postpartum period and then go into what postpartum depression is.
Postpartum period is the period following delivery and up to 12 months. Traditionally, we used to say up to 3 months, but we've seen actually it extends up to the first year of life. So that's the postpartum period. Postpartum depression is depression that occurs following delivery up to 12 months after delivery. Depression itself is a complex terminology, but mainly involves various feelings of low mood, feelings of helplessness, and we consider them if they're occurring anything between soon after delivery all the way to 12 months.
What are the causes?
So the actual cause is not known, because traditionally we used to say when you see this, there is more likely for this, but there are many people you think are likely to have it, but they end up surprising us and being very okay. But we think that genetics tend to play a big role. So if you've had somebody in your family who's had mood problems, who's had depression or what we call psychosis, then you're more likely to have it, and we actually like you being monitored closely. The others that we tend to see being attributed is if you get pregnant at a younger age, because we think maybe most of the time you may not be ready, you may not have the necessary social support around you, and maybe you are not so much independent. Those who also get unplanned pregnancies later on in life, maybe after the age of 45, have also been thought to have a slightly higher risk of getting depression. Others are those who lack social support at home, those who are coming from a disjointed family, they've been having marital conflicts, those who don't have good support from their in-laws, from the surrounding. We've seen them having a higher tendency towards having depression. Those who've had a bad outcome before, maybe you had a baby who had a problem at birth or even a neonatal death, have also been seen to be slightly at a higher risk of getting depression. Those who undergo emergency procedures in labor, you labored so much, got to 8 centimeters and had to be rushed for emergency cesarean section, because most of the time it's an emergency, we don't have enough time to brief you what happened, and maybe you are very motivated to have a normal delivery, so you actually feel that you didn't give your best. We've also seen them being at a slightly higher risk of getting depression. Another one is those who have pre-existing medical conditions, because your body is already dealing with so many other things, and that tends to put you at a slightly greater risk of having postpartum depression. The other very important risk factor for depression is intimate partner violence. So ladies who tend to have physical abuse or emotional abuse during their pregnancies, and these can actually even be from the spouse or even from the in-laws and so on, they are at increased risk of getting depression. So as part of the assessment for postpartum depression, we actually assess if there is features of intimate partner violence, because if we don't sort that out, then the depression is going to persist. I need to mention that postpartum depression affects about 10% of women following delivery. So it's quite a high number, so 1 in 10 is very high. So we need to actively look for it in every patient, and we always try to do it for every patient. Those who've had it before, this risk increases to about 20-30%. So it means you are almost guaranteed you're going to get it.
There are 3 types of moods that women go through after childbirth. Just take us through the 3.
So commonest is postpartum blues, which affects more than, let's say, about half of the women. And this is very short-lived and occurs within the first few days to about 2 weeks. It's a feeling where initially the woman has mixed feelings. You are weepy, you are crying, you are laughing. You don't really know what to expect the initial days. Good thing with it is it's harmless and it usually resolves on its own. The problem is at times it can be a precursor for the second one, which is depression. Now, depression is when you have now the more severe symptoms. As I said earlier, you could get inability to concentrate, inability to sleep, thoughts of self-harm, thoughts of harm to the others around you, baby, spouse, and such. Now, that is the more extreme form that actually requires very close follow-up. The other one, which we usually hope not to encounter, is the more severe one, which we call psychosis. Now, psychosis is very severe because most of the time the person becomes completely unaware of everything occurring around them. It's what we traditionally, people used to call mwendawazimu, because you've had somebody delivers and runs away and they don't want to see their baby, they start screaming, and all those extreme cases. And it's usually commonly manifested by the person having thoughts, a third-party voice talking to them. So you find somebody, another voice trying to direct you to do this, or you start seeing things that are not existing, that nobody else around you is seeing. And now that is really the extreme form. And for that one, we usually even prefer, because the chance of harm to the baby is very high, we prefer management in an hospital setting, with possible in a psychiatric unit.
If I am living with someone who is exhibiting some of those symptoms, what can I do to help that person?
So the first thing is to be supportive. Don't try to make them feel worthless. Don't try to make them feel there's something wrong they did, because most of the time they're actually sick. It's an illness like malaria, like high blood pressure, and so on. And what they need is support. So most of the time, if you are able to let them talk to you or express their symptoms out, don't dismiss them. Somebody tells you, you know, I'm not able to sleep. Don't tell them, you know, it's normal. No, by the time somebody actually comes to tell you a problem, then it's a problem. I'll not tell you nowadays I'm not eating if I don't think it's a problem. So listen to them, don't dismiss any symptoms. And even if you have no help to offer, just allowing them to talk to you is usually good enough. And most of them will tell you, you know, I feel nice after talking to you. And if you find it's symptoms that are persisting, that are likely to result in decreased attention to the baby, then your role as the caregiver or as the person staying with that patient is to encourage them to seek help. So as much as you might want to try and offer a helping hand initially by trying to be there at home, trying to tell them, oh, it will be well, it's okay, let me help you nursing the baby and so forth. Whenever you feel these symptoms are persisting, it's always good to come in early and maybe talking to another party or just being given some small medication, the person is going to feel better.
How is it managed once it's at medical attention?
So the management, we call it a multidisciplinary approach, and we manage it in conjunction with the psychiatrists. So most of the time we tend to manage the milder forms, but even with those ones we still get in touch with the psychiatrist so that they can help walk you through. So there's something called cognitive behavioral therapy, which means trying to retrain your mind to overcome whatever hurdles that are before you. Many women, for instance, will tell you the reason their mood went off is because the baby is crying a lot, and you can testify that the initial days after delivery the baby can be quite problematic at night. Yes. So if that is the case and we train you to tell you that, oh no, the reason the baby is crying is because there's a message they're trying to communicate. So we're trying to modify your behavior to actually understand that this is a message, and it's not that the baby is trying to show you that you are not worthy to be a mother, because some, with the cry, they start thinking that, oh, now I'm not a good mother. Maybe the baby doesn't want me. Maybe this, and especially if there's a lot of pressure from outside, it even makes you to sink deeper. So we try to modify your behavior and train you to understand how to cope with the environment. And now from there, we introduce some medications if there is no good response. So some peak pretty fast, and within the first 3 months they're fine, but some can persist up to even 1 year. And also to notice that the postpartum depression doesn't necessarily have to start immediately after delivery. Some can start even 5 months after delivery. It's bad when it persists longer, because then it might now make you go into the other depression, which is now what we call unipolar depression outside pregnancy. And now you'll require long-term follow-up. Yeah, but how long it lasts varies from person to person.
Your final words?
My final words is postpartum depression is very common. We should not feel shy to seek help if you start experiencing any mood disorders. If you start feeling low, you start feeling weepy, you start feeling things are not right, please seek help at the earliest opportunity. At times, just talking to someone can help. And if you find there's no help you can get around you, please come to the hospital. We have so many ways we can help you.
If you've not subscribed to the channel, please subscribe using the subscribe button below. You could also ring the bell to get notifications whenever we upload new content. Until next week, stay safe and goodbye.